Hello, everyone. My name is Angel Mora, and the agency that I will be presenting is Telecare Corporation. It specializes in mental health and substance abuse, and that is the field that I am actually going into. I am really hopeful in helping people in this field. Um, the history of Telecorp is it was founded in 1965. It was founded by Art Gladman, a psychiatrist, Lita Hahn, a psychiatric nurse, and Morton Baker, a businessman. Three individuals who were committed to a belief in the rehabilitation potential of people with serious mental illness. Art, Lita, and Morton believed that clients could achieve better results when they received services that were individualized, focused, and provided in a more home-like setting. Telecare has over 125 programs. It is located in 6 states, and that is Arizona, Nebraska, Oregon, California, Washington, and Pennsylvania. Here alone in California, it's located in 35 counties. Each of the programs has over 40 members. The mission statement for Telecare Corp is Telecare's mission is to deliver excellent and effective behavioral health services that engage individuals with complex needs in recovering their health, hopes, and dreams. The organization has a CEO, which is Ann L. Baker, has a senior vice president, chief medical officer, Ken Elder, and senior vice president of development, Faith Ritchie. Also Senior Vice President of Operations, Anita Barnas, and Senior Vice President, Chief Information Officer, Chin Chow, and the CFO is Leslie Davis. The funding is for Telecare Corp. It is a profit organization. It works very closely with the state and has a parole program. Because of this, much of the funding for this program does come from the state. Telecare Corp also works very closely with the mental courts and receives funding through the county. It also has funding through AB 109, Medi-Cal, and Medicare. The services that this agency provides are community-based, and Telecare provides a range of services in the community for people with or at risk for mental illness. Our community-based services are designed for people who can successfully live independently in the community with intensive services and support. It also has a served community treatment. The ACT model is a well-established approach for providing community-based services to individuals with complex needs. Services include assessment, services planning, housing assistance, pre-employment and vocational services, psychiatry, medication management, co-occurring disorder services, peer services, and assistance building natural support. It also has FSP, which is full service partnership, and that's basically a California-specific community-based program. And it's consumer-driven and highly collaborative programs that provide an array of wraparound services to individuals with complex needs, supporting people in addressing mental health symptoms and conditions, while building natural recovery supports and services and resources. Prevention and early intervention. These programs provide psychoeducation, early intervention, treatment, and coping skills, development for people at risk for mental illness. Support and education are also provided to family members. The case management services are strengths-based wraparound support for individuals with mental illness, but with less intensity than the ACT or FSP level. With the goal of preventing readmission, discharge teams provide time-limited case management for individuals in inpatient environments. Care coordination helps clients, primarily those with mental illness and chronic health conditions, to navigate the system of care, thereby the reducing use of emergency and inpatient services. This is in San Bernardino County, and they have a CSU, which is a crisis program that helps people who are experiencing mental health crisis to regain a sense of stability and avoid more restrictive settings. Crisis programs are typically unlocked settings for people to enter on a voluntary basis. And it also offers walk-in. These programs provide services to individuals who self-refer. Services include assessment, medication support, brief treatment, and links to support from communities. The typical length of stay is 6 to 8 hours. Crisis residential, these programs are for short-term residential support, medication services, and links to community services. They can also serve as a step down for those preparing to leave the hospital and return to the community. Normal stay here is about 30 days. And they have a crisis stabilization unit as well. These programs provide screening, triage, medication support, brief treatment in a safe, protective setting. These programs are sometimes correlated with acute inpatient programs, allowing for a warm handoff transfer when needed. The typical length is 24 hours. It offers acute services as well. Telecare's acute programs provide safe, therapeutic, and secure inpatient environments for individuals experiencing a mental health emergency. Services can be provided on a voluntary or involuntary basis. Their acute programs link individuals with ongoing care in the community to prevent readmission. The typical length is 3 to 10 days. They have freestanding acute psychiatric programs. These programs are staffed by a multidisciplinary team that provides assessment, symptom reduction, medication services, discharge planning, and resources, and supports development. Along with being licensed by the state, a number of Telecare's inpatient acute facilities are Joint Commission accredited and Medicare certified. They have a residential program which provide alternative for individuals with mental illness who would otherwise be placed in higher levels of care, such as state hospitals and IMDs. In home-like settings, residents address the issues and behaviors that put them at risk for institutional placement. Transitional residential treatment, these programs focus on skills development and community integration. Therapeutic services include community-based transitional services, recovery focus groups, and activities, medication management, education, transportation, intensive case management. Typical is 18 months. Long-term residential is programs that provide individualized recovery planning, support with daily living activities, crisis intervention, family and social relationship development, and medication assistance. Every program has a clinical supervisor, they have case managers, and they have a substance abuse counselor on site as well. Telecare is there to help build the skills of the member and educate the member on social skills to function in society and live productive lives. They have 5 key terms that they go by: exploring identity, awakening hope, making choices, reducing harm, and making connections. This agency's customers are 71% county, 5% state, criminal justice is 5%, regional centers is 8%, health plans is 6%, and the other 5%. By population, it goes serious mental illness. That's their main focus, is mental health. So they have 69% of the people there. Criminal is 13%, co-occurring is 1%, older adults 10%, transition is 4%, and adolescence is 1%. How do clients find out about this? Most of the people that come through Telecare are court ordered, or a social worker refers them. The strength, the agency provides a wide variety of services to people with co-occurring disorders. The staff is well equipped to service its population. It puts its members' needs first. Members grow into self-sufficient lives with the completion of the program. Limitations: the agency is understaffed. It is a great place to receive services, but the agency is understaffed to deal with the members that it services. Co-occurring disorders, substance abuse. It is important to recognize and acknowledge that substance abuse counselors have played and will continue to play a significant role in the treatment of COD. Individuals with substantial educational background, often seen as described for the treatment of mental disorder, if not mental disorders, are the exception rather than the rule in typical public programs, and there appears little reason to anticipate dramatic change in that situation. Co-occurrence of substance misuse and mental health conditions is an important problem in the treatment of substance use disorders and mental illness. Similarly, with the substance misuse equations, if substance use disorders are associated with the occurrence of mental disorders, then the coefficient of the interviewer's evaluation of the need of treatment for substance abuse cause is expected to be positive and statistically significant. Thank you.